The rights to reproductive autonomy and health are essential for individuals to survive, thrive, and live with dignity. But in the United States, laws banning abortion are harming patients and raising serious human rights concerns. The criminalization of abortion places clinicians in the impossible position of having to choose between the law and their patients' health and sometimes survival. And it harms not just them and their patients, but the entire medical system.
Whenever medical care is criminalized, clinicians suddenly must navigate enormous challenges. There's an immediate negative impact, especially for something like abortion care, where the care is time-sensitive, extremely common, and has an enormous and very personal impact on patients' lives. Clinicians who provide the same safe and necessary medical care that they have for many years are suddenly at risk of fines, threats to their licensure, even criminal charges. For clinicians actually working in abortion-banned states, this is an impossible situation. This predicament is known as dual loyalty. That is, when clinicians' obligations to their patients are in direct conflict with their obligations to a third party, like a state, a health system, an employer, or another entity that holds authority over them.
Clinicians have a moral obligation to be providing their patients with abortion-related care. Criminal abortion bans impede that ethical obligation and ask clinicians to actively participate in denials of human rights.
These abortion restriction laws represent an enormous burden for my patients in so many ways. Obviously, in states that have bans, patients may either try to end a pregnancy on their own without medical support, or they might continue an unwanted pregnancy and be forced to give birth, or they might decide to travel. Traveling for abortion care is just baseline an enormous financial and logistical burden. A few months ago, I saw a patient here in New York City who was actually from Louisiana. She was in the 20th week of her pregnancy and recently found out that her fetus had not developed a brain at all. It had a spinal cord and it still had a heartbeat, but no upper development of the neural system. In Louisiana, that's not a reason for being able to access safe abortion care. We had a safe abortion procedure with her, and she flew all the way home. Having to travel means that patients often access care later in their pregnancy. And while abortion is overall an incredibly safe procedure, having to wait for later in pregnancy increases the procedure risks.
Abortion criminalization frequently calls on providers to be complicit in human rights violations by denying necessary health care, causing pain and suffering, or violating bodily autonomy. Since the Dobbs ruling, the United States is in breach of obligations under several legally binding international treaties it has ratified, including the International Covenant on Civil and Political Rights, the International Convention on the Elimination of All Forms of Racial Discrimination, and the Convention Against Torture.
When faced with these dual loyalty questions, healthcare providers must think not only about the personal consequences of facing criminal charges, but also the very real impact these criminal charges could have on their current and future patient communities. Skilled providers are a scarce resource, and making a decision that endangers my ability to see future patients limits that scarce resource. These laws are impacting not just clinicians, but the practice of medicine in general. Due to the existing healthcare disparities in the United States, we also know that these harms are being felt most profoundly by Black, Indigenous, rural, and low-income patients.
As doctors, as OBGYNs, we can't stand for this.
If we are to provide evidence-based, ethical, and patient-centered healthcare, reproductive healthcare cannot be criminalized.
Healthcare providers across the country are speaking out to protect fundamental human rights of their patients and end these situations of dual loyalty. These laws are undermining the dignity of patients. Clinicians and medical associations are a powerful voice in the movement. Both are needed to demand that local and federal lawmakers put an end to the criminalization of healthcare.